Hello everyone, my name is Shalamitim Kangoyu and I would like to welcome you all to this massive open online course presentation. Today, I will be introducing and discussing the topic of understanding pertussis disease, also known as whooping cough. Now, let's dive into the content of this massive open online courses, which is divided into four parts. First is understanding the pertussis virus. Second, how this virus can be transmitted. Third, pertussis prevention. And last, the treatment of pertussis. Pertussis, also known as whooping cough, is a highly contagious respiratory disease caused by the bacteria Bordetella pertussis. The disease goes through three stages: catarrhal, paroxysmal, and convalescent, and typically lasts for approximately 6 to 10 weeks. The incubation period for this pertussis is usually 7 to 10 days. Now let's move on to the disease processes through the three stages. Pertussis symptoms vary by stages. In catarrhal stage, symptoms are similar to a common cold, runny nose, sneezing, low-grade fever, and mild cough. The paroxysmal stage is characterized by severe and rapid coughing fits followed by the high-pitched whoop sound. The convalescent stage is the recovery phase. The coughing fits may return with subsequent respiratory infection. The symptoms are more severe in infants or in individuals who have been never immunized against the disease. Many have thought wondering how can this be transmitted. Pertussis is spread through the air via droplets from the respiratory tract or infected individuals. Transmission typically occurs during the catarrhal stage and during the first 2 to 3 weeks of the paroxysmal stage. So how can we prevent pertussis? The best way to prevent pertussis is by getting vaccinated. There are vaccines called DPT, which stands for diphtheria, pertussis, and tetanus. It's really important to get your vaccine on time to protect yourself. The small risk of side effect from the vaccine is much smaller than the risk of getting really sick from the whooping cough. There are ways on how to cure and prevent pertussis. Treatment for pertussis involve the administration of antibiotic drugs that helps to clear the bacteria from the throat of affected individuals, usually within 3 to 4 days. Hospitalization may be necessary for serious ill infant with pertussis. Pertussis can be treated with antibiotics, but treatment may not be cure the symptoms. However, antibiotic will reduce the spread of disease to others. Antibiotics lessen the symptoms if given during the early stage of illness. When antibiotics are started later in the illness, the damage from pertussis is already done and the cough will last until the lungs heal. Preventing pertussis at home and school involve maintaining personal hygiene, such as regular hand wash, covering the mouth while coughing, and keeping surface clean. It's also important to isolate infected individuals to prevent the spread of the disease. Immunizations are particularly essential for children and adolescents to prevent outbreaks at school. Avoid close contact with others who are coughing or otherwise ill. If you have pertussis, stay at home and avoid close contact with others until you have taken antibiotic for at least 5 full days and are no longer infectious to others. Alright everyone, we reached the end of our discussion for today. But before we all sign off, I'd like to take a moment to circle back and highlight the critical points we'd covered. It's essential to remember these key takeaways as they form the foundation of our topic. Firstly, we delve into the understanding of pertussis, also known as whooping cough or the highly contagious respiratory disease. We'll learn about its stage, symptoms, and typical duration of the disease. Secondly, we discuss the transmission of pertussis, underscoring how it spread through respiratory droplets and the importance of recognizing the stage when transmission is most likely to occur. Next, We explore to the prevention of pertussis, emphasizing the significance of DPT vaccine and the importance of staying up to the date of the immunization. We also touch on the prevention strategies at home and school, highlighting the role of personal hygiene and isolation of infected individuals in preventing the spread of the disease. Lastly, we talk about the treatment of pertussis, highlighting the role of antibiotic in clearing the bacteria from the throat of affected individuals and the possible needs of hospitalization in severe cases.
Ano nga ba itong whooping cough or pertussis? Ang literal na meaning ng salitang pertussis ay violent cough. At maliban sa whooping cough, ang iba pang tawag sa sakit na ito ay the cough of 100 days. Malalaman natin mamaya kung bakit. Ang bakterya na nagbibigay sanhi sa sakit na pertussis ay ang Bordetella pertussis. Ang bakterya na ito ay nadiskubre noong 1906 at nakapag-develop na ng vaccine noong 1940s. Matagal na ang bakterya na ito, mas matagal pa kaysa sa pagiging single mo. Char! Bakit siya tinawag na whooping cough? Tignan natin ang video na ito. Ganon yung characteristic cough ng isang batang may pertussis. Sunod-sunod yung ubo to the point na mawawalan sila ng hininga, tapos hahabulin sa huli. Yun yung whooping sound. Kaya siya whooping cough. Kaya naman siya tinawag na the cough of 100 days kasi nagtatagal ng 2 to 3 months yung ubo. Pero syempre, mapapabilis naman yung recovery if treated early, and the duration of the symptoms is dependent on how strong and well-developed your immune system is. Mga newborn babies at mga bata lang ba ang affected sa pertussis? No, it affects all ages, pero majority talaga ng mga cases of pertussis belong to the pediatric population. 71% of cases ay mga batang younger than 5 years old. Mas high risk ang mga younger age group, lalo na sa mga less than 6 months old, kasi hindi pa ganun ka-developed ang immune system nila. Which is why vaccination is important to help protect the baby, kasi literal na wala pang kwenta ang immune system nila. Your vaccine for pertussis is the DTP vaccine. DTP, ibig sabihin diphtheria, tetanus, and pertussis vaccine. 3-in-1 na vaccine siya. 3 doses yung primary series given as early as 6 weeks old, tapos minimum of 4 weeks yung pagitan ng natitirang doses. Pag nakompleto na yung 3 doses, may mga booster doses pa at 12 to 18 months old, 4 to 6 years old, and 9 to 18 years old. Minimum of 4 years naman yung pagitan ng mga booster doses. Para sa atin na mga adults na may ubo at sipon, importante na huwag tayong lumapit sa mga buntis at mga babies kasi hindi natin alam kung regular flu lang ba ito or whooping cough na pala. Ang pertussis, mako-confirm lang ang diagnosis niyan through a throat and nose swab na ipapa-PCR test. Hindi tayo umaasa sa sintomas lang para sabihin na, pertussis ito kasi yung ubo niya parang whooping cough eh. Hindi ganun yun. Mas developed kasi ang immune system nating mga adults kaya maaaring hindi natin maranasan yung whooping cough na sintomas. Maaaring simpleng ubo at sipon lang ang nararamdaman natin without knowing na pertussis na pala yun. Kaya bilang respeto sa mga vulnerable population tulad ng mga buntis at mga babies, kung alam natin na may ubo at sipon tayo, wag na tayong pumunta sa mga events kung saan alam natin may buntis at mga babies. For example, binyag ng baby. Kasi para sa atin, maaaring mild lang yung sintomas, pero pag nahawaan yung baby, sobrang lala ng sintomas tulad ng nasa video na pinakita ko kanina. To the point na ma-admit siya sa ospital. Kawawa naman, kaya self-isolation is the key. Paano ba natin maiiwasan ang pertussis? Actually, sa kahit na anong infection, ito lang ang kailangan nating tandaan. Maintain a strong immune system through a balanced and nutrient-dense diet and regular exercise. Pero Doc, may mga healthy na nagkakaubo at sipon pa rin naman. Yes, pero mas mabilis ang recovery. Other ways of preventing infection is proper hygiene. Always wash your hands with soap and water before touching any part of your face. Wearing a face mask in crowded and congested areas, and of course, getting vaccinated. Pwede ba magpa-vaccine ang mga adults against pertussis? Yes, pwedeng-pwede. Ask your doctor.
I hope this decay point resonated with you and helped deepen your understanding of pertussis. Remember, the knowledge we share today is not just for you but for those people around you. By staying informed and taking the necessary precaution, we can play a part in preventing the spread of this disease. Thank you all for the time and engagement in today's session. Let's continue to learn, share, and grow together. Stay safe, everyone, until our next discussion.